Hello friends, my name is Dr. Arun Kumar. From today we are starting a new course, that is Antibiotics for medical students. This course will provide students with a thorough understanding of antibiotics, including their mechanism of action, uses, side effects, resistance, and proper clinical applications. Through lectures, case studies, and practical sessions, student will gain essential knowledge and skills to effectively use antibiotics in a clinical practice. This course will be of 3 months, that is per week there will be one video. In the first week we will deal with introduction to antibiotics, starting from history, discovery, development and classification, and overview of the bacterial infections. In the second week we will discuss the mechanism of action of various antibiotics like cell wall synthesis inhibitor, protein synthesis inhibitor, nucleic acid synthesis inhibitors, etc. In third week, we will deal with the antibiotic spectrum of activity, that is the narrow spectrum, broad spectrum, and specificity and effectiveness against the different bacterial strains. In the fourth week, we will discuss the pharmacokinetics and pharmacodynamics, that is absorption, distribution, metabolism, and excretion of antibiotics, doses, forms, and routes of administration, time dependent and concentration dependent killing. In the fifth week, we will discuss the clinical use of antibiotics, their indications, empirical versus definitive therapy, prophylactic use of antibiotics, and antibiotic stewardship and rational prescribing. In the sixth week, we will deal with the adverse effects of antibiotics, common side effects, severe side effects, and drug specific, some examples of drug specific side effects. In the seventh week, we will discuss antibiotic resistance, mechanism, factors contributing to resistance, global impact of resistance, and what are the different strategies to combat the antimicrobial resistance. In the eighth week, we will discuss antibiotic susceptibility testing, method of testing, that is disk diffusion, MIC determination, E-test, interpretation of result, and clinical relevance of susceptibility testing. In the ninth week, we'll discuss antibiotic use in specific populations like pediatric use of antibiotic in pregnancy and lactation, geriatric consideration, and antibiotics in immunocompromised patients or individuals. In the 10th week, we will discuss some case studies and clinical scenarios, that will real life case studies involving antibiotic use, problem solving and decision making exercises and presentations. In the 11th week, research and development in antibiotics, that is current trends in antibiotic research, new and emerging antibiotics, challenges and future directions, and current trends in antibiotic research. In the last week, that is in the week 12, we will having examples of practical sessions, not really practical, but we will having an assessment session, that is written assessment we will do. So we have prepared this course for all the medical students. Kindly stay tuned with us if you are interested in doing this course. Till then, subscribe our channel and share among your friends and colleagues. Thank you.